Magnesium glycinate should calm you. So why does it sometimes wake you up at 3 a.m. with your heart racing? That's the exact question a woman in my clinic asked me last week, and it's one I hear a lot from patients over 60. The supplement that's supposed to relax muscles, steady nerves, and help with sleep can, in certain situations, feel like it's working against you. The good news is that most of the time the problem isn't the magnesium itself. It's a few common habits that change how the body handles it. I'm Dr. Emily Carter. I've been working with older adults for decades, helping people with sleep, cramps, heart rhythm concerns, and medication management. Over the years, I've seen the same patterns repeat. A well-intentioned person starts magnesium glycinate, and instead of calm, they notice jittery nights, foggy mornings, loose stools, or odd palpitations. When we look at the full picture, their meals, drinks, other pills, how much water they drink, and their kidney function, the cause usually becomes clear. Before we go deeper, a quick reminder. If this video is already answering a question for you, please give it a like and subscribe so you don't miss the practical tips I share for aging well. Magnesium does many helpful things. It's a cofactor for hundreds of reactions. It helps muscles relax, it stabilizes nerve firing, it supports a steady heart rhythm, and it contributes to sleep quality by helping the nervous system move toward calm. But for magnesium to do those jobs, it has to be absorbed in the gut, enter cells where it's needed, and then be cleared safely by the kidneys when the body is done with it. Any disruption along that path, binding in the gut, being pushed out in urine, competing with other minerals, or being trapped outside cells because a cofactor is missing, can blunt benefit or produce side effects. I want to cut straight to what I see most often. There are 5 critical errors that repeatedly undermine magnesium glycinate in older adults. I'll label them A through E, and I'll give a practical fix with each. Later, I'll unpack the first ones in more detail, and we'll walk through a real-world example of how these mistakes compounded in one patient. For now, here are the 5 critical errors and a short corrective step for each, so you have the roadmap in mind. Critical error A. Poor timing with meals and mineral-blocking foods. Short fix. Avoid taking magnesium immediately after high phytate or calcium-rich meals. Space it 1 to 2 hours away from beans, whole grains, spinach, or a dairy-heavy plate, or take it with a neutral snack like plain toast or white rice. Critical error B. Beverage timing. Coffee, tea, alcohol, and carbonation near dose. Short fix. Keep caffeinated drinks and alcohol at least an hour or 2 away from your magnesium dose. Choose non-caffeinated, still options in the hour before and after if you're aiming for maximal absorption. Critical error C. Large single doses and nervous system timing. Short fix. Split the daily amount into 2 or 3 smaller doses through the day and make magnesium the final step in a calming bedtime routine rather than the first thing you do when you're wired. Critical error D. Pill stacking and drug supplement interactions. Short fix. Separate magnesium from calcium, iron, zinc, certain antacids, PPIs, and high-dose vitamin D by about 2 hours, and discuss any prescription diuretics or heart medications with your clinician before making changes. Critical error E. Hydration, kidney clearance, and nutrient cofactors. Short fix. Hydrate before dosing. A modest drink of water 30-40 minutes beforehand. Check kidney status with your clinician if there's any concern. An estimated GFR below 60 is a flag for closer monitoring, and consider whether cofactors like vitamin B6 and electrolyte balance are addressed under medical guidance. Those 5 labels are the heart of what I want you to understand. Now let's take the time to look at how and why the first few of these create trouble in everyday life. Critical error A. Poor timing with meals and mineral-blocking foods. This is one of the most common and most fixable mistakes. In the gut, minerals can compete and bind to one another or to compounds in food. Whole grains, legumes, nuts, and some leafy greens are rich in phytates and oxalates, molecules that bind minerals. Dairy and calcium-rich supplements introduce extra calcium that competes directly with magnesium for absorption. If you take magnesium right after a big bowl of beans and brown rice, or with a calcium-heavy meal like cottage cheese and milk, much of that magnesium can be held in the gut and pass through without getting into your bloodstream. How it shows up. People describe taking magnesium and feeling nothing. Others report mild gastrointestinal upset, looser stools or cramping because the unabsorbed mineral pulls water into the bowel. Some older adults say their nighttime rest doesn't improve or their daytime cramping continues despite taking the supplement. Why it's common after 60. Many older adults eat smaller meals but choose foods high in phytates, like whole grain breads, bran cereals, or large portions of beans, because of fiber or habit. Others take calcium or vitamin D with meals, which is sensible for bone health, but can interfere if taken at the same moment as magnesium. Simple fixes that actually work. Aim to separate magnesium from mineral-heavy meals by about an hour or two. If you take a pill with dinner because it's the time you won't forget, try moving it a bit later, or take a small neutral snack with the magnesium. Plain white rice, a piece of plain toast, or a small banana. These are low in phytates and won't capture the mineral. If you rely on a calcium supplement for bone health, take that at a different time of day, perhaps earlier in the morning, rather than at the same table as magnesium. A short clinical note. If you're on a calcium carbonate antacid or on prescribed calcium, mention that to your clinician so they can help you set a safe schedule. Don't stop prescribed medications on your own. A small example from practice. Mrs. K thought magnesium wasn't helping because she always took it with her nightly glass of milk and bowl of bran cereal. Moving the magnesium an hour later, after a cup of plain white rice or a small cracker, made a measurable difference in how she slept and in her cramp frequency within a few days. Mini transition. That food timing problem is one step. Drinks are another, and they're often even sneakier. Critical error B. Beverage timing. Coffee, tea, alcohol, and carbonation. Near dose. Not all liquids are neutral. Coffee and many teas contain tannins and caffeine. Alcohol changes kidney handling of electrolytes and can interfere with sleep architecture. Carbonated beverages alter stomach pH and can affect how minerals dissolve and are presented to the absorptive parts of the intestine. Even non-alcoholic sparkling water, while harmless for most, sometimes accompanies food choices that matter. A cup of black tea with your cuppa and your supplement, or a glass of wine around the time you take magnesium for sleep, can be precisely the habit that makes the difference between benefit and bother. How it shows up. Some older adults take magnesium in the evening with a nightcap and then wake with lightheadedness or palpitations. Others find their magnesium seems to give them loose stools when the real issue was a large glass of iced tea an hour before. Caffeine is a stimulant and can counteract the calming intent if taken too close to the dose. Alcohol, meanwhile, increases urinary magnesium loss and impairs sleep stages, so pairing a nighttime magnesium with alcohol can be counterproductive. Why it's common. Evening routines often include a cup of tea, a seltzer, or a glass of wine. People take supplements the last thing before bed because it feels like a final act of self-care. That timing makes sense from habit, but it creates an environment where absorption is reduced, or the intended calming effect is blunted. Practical, non-dramatic adjustments. Try to keep caffeinated beverages at least an hour or two away from a dose of magnesium. If you enjoy an evening hot drink, choose a non-caffeinated herbal tea or warm milk, if that agrees with you. Avoid alcohol in the hour or two surrounding a nighttime dose when the goal is improved sleep. If carbonation is your favorite, switch to still water around supplement time for a few nights and see whether your symptoms change. Safety reminder, alcohol interacts with many medications, so if you take prescription sleep aids, blood pressure pills, or pain medications, a conversation with your clinician is important before changing drinking habits. Critical error. C. Large single doses and nervous system timing. There's a common belief that taking a large dose at bedtime will force sleep. The reality is more nuanced. The gut can only absorb so much magnesium at once. A very large single dose often results in a limited incremental absorption and more unabsorbed magnesium reaching the colon, which can cause loose stools. For some people, that sudden influx triggers mild autonomic reactions, awakenings, transient palpitations, or a wired feeling, especially when the dose is taken at a time the nervous system is already overstimulated by screens, stress, or caffeine earlier in the day. How it shows up. Someone takes one big capsule at night, hoping to sleep through, and ends up waking at 2 a.m., feeling oddly alert or with mild heart fluttering. Others complain of digestive upset after a single large pill, or say they feel drowsy after taking it, yet can't get into deep sleep. Why it's common? Convenience. One pill before bed is easier than several through the day. Also, when people are desperate for better sleep, they try a larger dose thinking more is better. And finally, magnesium taken during an already stimulated state, after screen time, late phone calls, or stressful tasks, will be less effective because the nervous system needs a sequence of calming signals, not a single biochemical nudge. Fixes that actually help. Divide the daily intake into 2 or 3 smaller doses, one in the morning or mid-afternoon, and one in the evening, rather than one large nightly dose. Think of magnesium as a helper that needs an open door to enter cells gradually. In the evening, make magnesium the last step in a short calming routine. Dim lights, a warm, non-caffeinated drink, quiet down screens for 30-60 minutes, and then take your magnesium. That order matters. Magnesium works best when your nervous system is already shifting toward rest. Usefulness without overreach. This isn't a prescription. It's a practical approach many patients find soothing, and it avoids the digestive side effects that come from a single big dose. If you're on medications that require exact timing, check with your clinician before changing when you take supplements. At this point, you might be wondering how all these habits intersect with the medicines many older adults take. That leads to the next major set of problems. Critical error D. Pill stacking and drug supplement interactions. Pill stacking is what happens when we try to manage bone health, heart rhythm, blood pressure, iron deficiency, and sleep all at once with multiple pills at the same moment at the dinner table. Minerals compete in the gut. Certain medications alter gastric acidity, affecting absorption. Diuretics change urine excretion. Proton pump inhibitors and antacids can reduce magnesium uptake. Calcium and iron are obvious competitors at the absorption step, and higher doses of vitamin D can influence calcium balance, which in turn can affect magnesium's role. How it shows up. Someone who takes a multivitamin, separate calcium and magnesium at the same time may see reduced effect from the magnesium or feel more side effects. People on loop or thiazide diuretics sometimes report clearer shifts in their energy and salt balance after starting magnesium. But these changes need to be monitored because diuretics can increase or decrease magnesium depending on the type. Similarly, patients on PPIs sometimes absorb less magnesium from oral supplements. Why it's common? Older adults accumulate good intentions, a vitamin for bones, an iron supplement for anemia, a pill for sleep, and a heart medication prescribed years ago. It's practical to take them together, so the habit becomes entrenched. What to do? Separate magnesium from other mineral-containing supplements by roughly 2 hours if possible. If you take calcium or iron for clinical reasons, put them at different times of day than magnesium. If you are on diuretics, heart rhythm medications, or a PPI, Mention that to your clinician. Don't discontinue anything on your own. These interactions are not a reason to stop magnesium wholesale. They are a reason to coordinate timing and monitoring with a provider who knows your full medication list. A specific but gentle flag. If your clinic records show an estimated GFR below 60, that's a sign for closer discussion about kidney clearance and monitoring. It's not an absolute contraindication, but it is a boundary that changes how aggressively we might prescribe or recommend supplementation without labs. Critical error, E, hydration, kidney clearance, and nutrient cofactors. Finally, and perhaps most importantly for older adults, is the internal environment. Hydration levels, kidney function, and the presence of cofactors like vitamin B6 or a balanced electrolyte status together determine if magnesium reaches cells and then clears safely. Mechanisms at a glance. Dehydration concentrates blood and can make kidneys handle minerals differently. Kidneys are the primary route for clearing excess magnesium. When kidney function declines, magnesium can accumulate. On the other hand, some patterns of dehydration increase urinary magnesium loss. Vitamin B6 and other co-nutrients assist transport of magnesium into cells. Low levels of these cofactors can make supplementation less effective. How it shows up clinically: fatigue that doesn't improve, persistent brain fog, muscle cramps that persist despite taking magnesium, or new palpitations can all be signs that the internal environment isn't optimized. Some people experience GI symptoms because poorly absorbed magnesium moves into the colon. Others may have subtle worsening of symptoms if their kidneys are not clearing minerals as they should. Practical, cautious steps. Hydrate consistently rather than binging fluids. A modest drink of water 30-40 minutes before taking magnesium can help present it to the absorptive surface in a less concentrated meal environment. If you have known kidney disease or chronic conditions, check with your clinician. An estimated GFR below 60 is a meaningful threshold where closer monitoring of minerals is usually advised. Regarding cofactors like vitamin B6, consider discussing a trial of a B complex or food sources with your clinician rather than adding isolated high-dose B6 on your own. An important point here: these internal factors are not about blame. Aging changes how the body handles fluids and minerals. Small adjustments often restore benefit without radical changes. But because kidney function and drug interactions can matter, it's essential to coordinate with your healthcare team. A patient example that illustrates how these 5 errors can pile up. Let me tell you about Noah. He's 72, retired, and an avid gardener. He started magnesium glycinate because he'd been waking up at night with leg cramps and light sleep. He was careful and conscientious. He read that magnesium can help and bought a well-reviewed supplement. But Noah did a few things that are textbook examples of how small habits compound. He took a single, large magnesium pill right after dinner because it was the time he was at the table and wouldn't forget it. Dinner for Noah often included a spinach salad and a bowl of beans, both high in phytates and oxalates that can bind minerals. He enjoyed a cup of black tea after that meal. He was on a low-dose diuretic for mild fluid retention prescribed years earlier, and he took a calcium supplement in the morning for bone health. He often forgot to drink much water during the day, and his last lab values showed his estimated GFR was slightly below 60, nothing dramatic, but enough to flag that kidneys were not at their prime. Within a week of starting magnesium, Noah told me he felt a bit more alert at night, and sometimes noticed heart fluttering. He also had a few loose stools that he hadn't had before. Initially, he worried the supplement was simply bad for him. But when we unpacked the timing and interactions, a clearer picture emerged. Step 1, we spaced things out. I asked Noah to move magnesium away from dinner, to take it later after a neutral snack or in divided doses. We also shifted his evening tea to a non-caffeinated herbal option to reduce tannin and caffeine effects near dosing. We avoided changing his diuretic on our own. Instead, I coordinated with his primary care clinician to look at timing and potential monitoring. We checked how much water he drank and agreed on a small, consistent hydration plan rather than a sudden increase. Step 2. We split the dose. Instead of one large pill at night, Noah tried 2 smaller moments, one mid-afternoon and one after his evening wind down, but only after his tea and spinach salad were well spaced. He also kept his calcium in the morning as before. Step 3. We checked labs and cofactors. His clinician reviewed recent labs, including an estimated GFR, and we discussed the potential benefit of confirming vitamin B6 levels via diet or a supervised supplement trial rather than adding high doses independently. Within a week of those changes, Noah reported that the fluttering decreased and his sleep began to feel more consolidated. He still had some nights that were restless, and we agreed to monitor and refine timing rather than jump to bigger doses or stop medications. These were small, layered adjustments rather than dramatic overhauls, and they made a measurable difference. Where we are now with Noah, the early signs were encouraging but not definitive. We wanted to see if the improvements persisted across multiple weeks and whether labs would require further attention. That slow, stepwise approach, making one change, monitoring, then adjusting, keeps safety first and often restores benefit without creating new problems. A quick pause for reassurance. You're not alone if you've tried magnesium and been disappointed. Many older adults are doing everything right in spirit, but missing 1 or 2 timing or interaction details that make all the difference. The rest of what I'll explain will show how to test these adjustments in a calm, practical way. What I'll unpack next, I've walked you through the 5 critical errors at a high level and dug into A, B, and C in more depth, with Noah's experience as a real-world anchor. In the next section, I'll go deeper into pill-stacking specifics, common prescription culprits, practical ways to space medications safely without guessing, and the kinds of questions to bring to your clinician. I'll also go into hydration strategies that are comfortable for older adults, how to interpret that estimated GFR below 60 flag in a way that avoids alarm but promotes sensible monitoring, and how to think about cofactors like vitamin B6 in food-first terms. Before we move into those specifics, take a moment to think about your own routine. Do you take magnesium at the dinner table? Do you often have tea or a nightcap nearby? Do you habitually take multiple mineral-containing supplements at the same time? Noticing the pattern is the first action step, and small changes often yield surprisingly quick improvements. Noticing the pattern is the first action step, and once you do, the next move is testing one change at a time so you can see what helps. Let's get practical about the pill-stacking specifics, hydration and kidney issues, cofactors, and realistic schedules you can try without overhauling your whole routine. Pill-stacking and interactions, practical specifics you can use today. When I talk about pill-stacking, I mean the natural habit of taking multiple mineral-containing products or interacting drugs at the same moment. Multivitamin, calcium for bones, an iron tablet for anemia, a PPI for reflux, and a sleep aid all at the same table. Here are the common culprits I see and the everyday steps that usually make the difference without changing prescriptions on your own. Common items that compete with magnesium in the gut or alter its handling include calcium supplements or calcium-rich meals, iron supplements, zinc, antacids or proton pump inhibitors, PPIs, and certain prescription diuretics or heart medications. These don't always mean you can't take magnesium safely. They just change the best timing and sometimes warrant a quick check with your clinician. A sensible rule most patients can adopt is a spacing approach. Separate magnesium from other mineral supplements by roughly 2 hours when possible. For example, if you take calcium with breakfast because that's your habit for bone health, make magnesium a mid-afternoon or evening item instead. If you take iron for anemia with lunch, Avoid magnesium at lunch. Move magnesium to a different time. If you use a PPI for reflux, note that these medicines can blunt absorption of some nutrients. So mention the PPI to your clinician and ask whether timing adjustments or monitoring are appropriate. Diuretics deserve a gentle special mention because their effects on magnesium can vary by type. Some diuretics change how the kidneys excrete magnesium and can lead to lower magnesium levels. Others have different effects. That's why I never recommend changing a prescribed diuretic at home. Instead, tell your clinician you're taking magnesium. They can check whether your current diuretic changes how we monitor or time supplements. The same goes for heart rhythm medications. Coordinate, don't guess. A practical checklist for spacing without guesswork. Keep calcium or iron at breakfast. Consider a mid-afternoon magnesium if that fits your routine. Make the evening magnesium a small, calming dose after your wind down, rather than amid a stack of other pills at the dinner table. That simple rearrangement often solves the competition problem. Hydration, kidney clearance, and what estimated GFR below 60 actually means. Hydration and kidney function determine how the body handles minerals. With aging, our thirst sensation can decline and kidney clearance often changes. That's why I emphasize consistent, modest hydration rather than large, sudden fluid loads, and why I flag kidney function when I talk about safe supplementation. A practical hydration approach. Sip steadily throughout the day. Aim for gentle consistency, small glasses or a half cup of water every couple hours if that works for you, rather than drinking a liter all at once. When you plan to take magnesium, a modest drink of water 30-40 minutes beforehand makes the supplement arrive in a gut that's not overly concentrated from a heavy meal or a long dry spell. That can improve how it dissolves and meets the absorptive surfaces. You'll see the phrase, estimated GFR below 60, often in clinical notes. That is a commonly used flag that tells clinicians to pay closer attention to kidney clearance of medications and minerals. It isn't an automatic ban on magnesium or other supplements, but we treat it as a prompt to monitor more closely, check labs as needed, and coordinate dosing decisions with the person's clinician. If your last lab shows an estimated GFR below 60, bring that to your provider's attention before making large increases in supplemental magnesium or starting new mineral regimens. What might prompt sooner contact with your clinician? New or worsening symptoms such as persistent lightheadedness, fainting, progressive muscle weakness, significant changes in urination patterns, or breathlessness should prompt timely medical advice. For milder concerns, new palpitations, recurring loose stools, or daytime fog that starts after a recent change in supplements, pause the supplement and call your clinician to review. Don't stop prescribed medications on your own. Pausing an over-the-counter supplement to see if symptoms improve is a reasonable short-term troubleshooting step, done while you plan a clinician discussion. Cofactors and food-first ways to support magnesium's movement into cells. Magnesium doesn't work alone. It often needs vitamin B6 and a balanced internal electrolyte environment to move from blood into cells where it does its job. High-quality food sources are a safe first step for most older adults. Foods that provide vitamin B6 and support overall electrolyte balance include chickpeas and other legumes, lean poultry, fish like tuna, bananas, potatoes with the skin, and whole foods that fit your preferences and digestive tolerance. If you and your clinician decide that a supplement for B6 or a B complex is reasonable, approach it as a supervised trial rather than a long-term automatic addition. Explain why. Older adults can have different nutrient needs and multiple medications that interact, so it's wise to integrate micronutrient changes into overall care rather than layering them on without oversight. Troubleshooting the most common reactions. What to try first. If magnesium gives you looser stools, the first step is to stop a single large nightly dose and split it. Dividing the amount into 2 or 3 smaller doses during the day usually reduces gut symptoms because each dose is more likely to be absorbed rather than passing into the colon. If you already split doses and still have GI upset, try taking magnesium with a small neutral snack, plain toast, a small portion of white rice, or a banana, rather than with a high-fiber or dairy-rich meal. If you notice transient palpitations or a wired feeling after taking magnesium, look at the context. Did you take it right after a cup of black tea or a glass of wine? Did you take it immediately after a stressful task or after staring at screens? Try moving the dose away from stimulants and making it the last step in a brief calming routine. Dim lights, silent screens, do 30 minutes of quiet activity, and then take a smaller evening dose. If palpitations are severe, recurrent, or accompanied by fainting, seek urgent care. For milder symptoms, pause the supplement and arrange a clinician review. If you're on several mineral-based supplements or medications, create a simple timetable. For example, take calcium with breakfast, iron with lunch, and magnesium mid-afternoon, plus a small evening dose after the wind down. Keep a written list of what you take and when. It helps clinicians spot stacking and makes medication reconciliation faster and safer. Sample daily schedules you can adapt. These are examples you can discuss with your clinician and adapt to your life. Option 1. Steady spacing. Breakfast, medications or supplements that need an empty stomach or are best in the morning. For instance, calcium, if that's your usual. Mid-afternoon, first magnesium dose with a neutral snack. Evening, second, smaller magnesium dose after a 30 to 60-minute wind-down routine, avoiding caffeine or alcohol in the hour or two before and after. Option 2, convenience with separation. Keep iron or multivitamin at lunch. Keep calcium or bone health supplements in the morning. Take magnesium mid-afternoon and again after your pre-bed calming time. If you prefer a single dose, pick a late afternoon time rather than immediately before bed, so the supplement settles before your nervous system begins its sleep transition. Remember, these are patterns, not prescriptions. If you're taking medications that demand exact timing, your clinician will help you choose the best slot. How labs and monitoring fit into this plan. Serum magnesium levels are sometimes checked, but they don't always reflect total body magnesium. What is often most clinically useful is a basic set of labs that includes kidney function, hence the importance of the estimated GFR below 60 flag, and electrolytes when there is concern about imbalances. If your provider thinks it helpful, they may look at a basic metabolic panel and discuss whether continued supplementation is appropriate or whether periodic monitoring makes sense given your medications and kidney function. Follow-up timing is usually modest, a few weeks after a change to check symptoms and then labs if there are concerns. The goal is stepwise adjustments. Change 1 or 2 things, watch over 1 to 2 weeks for patterns, and then tweak again if needed. Noah's follow-through and what we learned. After Noah and I made the initial changes, spacing magnesium away from his spinach and beans dinner, switching his black tea to herbal in the evening, splitting the dose, modest hydration before dosing, and coordinating with his primary care clinician on monitoring, he began to see improvement within a week. The palpitations decreased and his sleep felt more consolidated. Over the next month, we kept a close eye. He tracked nightly sleep quality, daytime fog, and stool consistency, and his clinician repeated some basic labs. A few lessons from Noah's case that generalize well. First, small layered changes made a measurable difference without stopping any of his prescription medications. Second, coordination, letting his clinician know that he'd started magnesium, allowed us to interpret his lab results in context. Third, the process was iterative. We didn't expect perfection overnight, and we made adjustments based on feedback rather than guessing. That kind of stepwise approach will serve most older adults well. What to try if you've already stopped magnesium and want to restart? Some people stop supplements after a bad experience. If you stopped magnesium and want to try again, I recommend a cautious, staged reintroduction. Restart at a smaller perceived amount. Split the intake across the day. Avoid taking it near a mineral-rich meal. Keep caffeinated and alcoholic beverages distant from the dose, and maintain gentle hydration. Bring your medication list to your clinician and consider having a follow-up plan for checking symptoms and labs within a few weeks. A few quick safety flags to keep in mind. If you have any of the following, call your clinician promptly. Fainting, severe or prolonged palpitations, progressive muscle weakness, sudden breathlessness, or new confusion. These are rare, but important to act on. For milder worries, new palpitations that come on after taking a supplement, recurring loose stools, or persistent fog, pause the supplement and contact your clinician to review timing, interactions, and whether any lab checks are indicated. What to do tonight? Start with these 5 simple actions you can do tonight. Move your magnesium away from a heavy, mineral-rich dinner. Choose a non-caffeinated drink or still water in the hour before and after your evening dose. Split any large single dose into smaller moments across the day if you can. Take a modest glass of water 30-40 minutes before your next magnesium dose. And make a short note of every pill and supplement you take at dinner so you can show it to your clinician. These small moves let you test changes one at a time and see what helps. A brief recap of the 5 critical errors to keep in mind. Critical error A. Poor timing with meals and mineral-blocking foods. Avoid taking magnesium immediately after phytate or calcium-heavy meals. Space by 1-2 hours or use a neutral snack. Critical error B. Beverage timing. Keep coffee, tea, alcohol and carbonation away from dosing windows. Choose non-caffeinated, still options near supplement time. Critical error C. Large single doses and nervous system timing. Split the daily amount into smaller doses and make magnesium the final step in a calming evening routine. Critical error D. Pill stacking and interactions. Separate magnesium from other mineral supplements and notify your clinician about diuretics, PPIs, or heart medications. Use roughly 2-hour spacing when possible. Critical error E. Hydration, kidney clearance, and nutrient cofactors. Hydrate consistently, note if your estimated GFR is below 60, and discuss monitoring, and consider food-first cofactor strategies like vitamin B6 under medical guidance. Final encouragement and a practical nudge. Most people who feel worse after starting magnesium aren't experiencing failure. They're encountering modifiable interactions between food, drink, medications, and the body's changing physiology. Tiny, deliberate adjustments, spacing, splitting doses, gentle hydration, and coordinating with your clinician often restore the expected benefits without drama. If one change doesn't help, pause and try the next. Keep a short log for a couple of weeks, what you took, when, what you had to eat or drink, and how you felt overnight and the next day. That record is incredibly useful in a clinic visit and helps you see patterns quickly. If this message has been helpful, please subscribe and leave a comment telling me which of the 5 errors surprised you most. I read many of the comments and I use them to shape future practical guidance. If you're working through a complex medication list or have known kidney issues, bring this conversation to your clinician so you can design a plan that fits your medical history. Thank you for spending this time with me. Small, thoughtful changes often make a big difference, and with a little patience and coordination, we can usually get magnesium working the way it was meant to, supporting calm, easing cramps, and helping sleep without unintended side effects. I'm Dr. Emily Carter. Take care, and I'll see you in the next video.